Hi friends, I am Dr. Dattaram. I am a consultant surgical gastroenterologist and a laparoscopic surgeon practicing in Hyderabad. So gastroesophageal reflux disease. So this condition is very common. Many patients including youngsters, middle-aged, the old people do suffer from gastroesophageal reflux disease. You all know what is GERD. GERD is nothing but reflux of acid and stomach contents into the food pipe. Patients with GERD experience severe lower chest burning kind of pain. They have regurgitation of food into the mouth. When they bend forward, these symptoms worsen. Some people have complications of the disease in the form of esophageal ulcerations, strictures, and bleeding from the ulcerations, and Barrett's esophagus, that is a pre-malignant condition. Not only that, patients have volume reflux, that is regurgitation of food into the mouth and aspiration into the lungs. So when they sleep, they tend to aspirate the stomach contents into the lungs. They have cough, they develop pneumonias, and they have change in voice. So many patients who have acid reflux, they are not adequately controlled with medications, and when they stop medications, they develop these symptoms again. And many patients will develop symptoms very fast after stopping the medications. GERD is a very disturbing condition. It affects the quality of life. Many patients with acid reflux do improve with simple lifestyle measures like losing weight, changing the diet in the form of a low spicy diet, low volume diet, so having an early dinner, raising the head end of the bed. So all these things, they help to control acid reflux symptoms, and many of them will improve with proton pump inhibitors, which actually reduce the acid to zero in the stomach. So but these measures are not effective for all patients. So there are patients who definitely have symptoms, very severe symptoms, who are not adequately controlled with medications, who develop complications of acid reflux in the form of ulcerations, bleeding from the ulcerations, strictures, and Barrett's esophagus. They have volume reflux, that is aspiration into the lungs, etc. So these are the patients who need some intervention to restore the abnormal anatomy of the GE junction, which is causing the reflux. Mainly the hiatus hernia. Some patients have a very large hiatus hernia, that is protrusion or the slipping of the GE junction into the chest. This will make the control of reflux symptoms very difficult. So these are the patients who need intervention in the form of surgical treatment. So many patients who ask me, when I say go for surgery, they ask me, why not endoscopic therapy? Yes, endoscopic therapies are very attractive because most of these procedures are performed on a daycare basis. You can go home on the same day after the procedure. One can do the procedure in sedation. You don't need any anesthesia for these procedures, and moreover, these are painless. So why not opt for endoscopy? Excellent. So the problem with endoscopic therapy is that they are newer, they are experimental, and they are not established forms of treatment. The endoscopic therapies may not restore the distorted anatomy completely. The results of endoscopic therapy are not as expected. They don't give the desired result after the procedure. I have been doing fundoplications for more than a decade now. So for patients who need surgery or any intervention, I would advise them to undergo a laparoscopic Nissen fundoplication. So laparoscopic Nissen fundoplication is the surgery or the treatment of choice for patients who are not improving with medical treatment or who have complications or volume reflux. So this procedure is done by minimally invasive method under general anesthesia. Entire distorted anatomy, that is the hiatus hernia, is reduced into the abdomen. The abdominal esophagus is restored. Diaphragmatic crura, that is the opening between the chest and the abdomen, is narrowed by approximating the diaphragmatic crura, and the lower esophageal sphincter, which is actually the most important anti-reflux mechanism, is restored by surgery alone, by wrapping the fundal part of the stomach, that is the fundus of the stomach, around the GE junction and the lower esophagus. This prevents acid reflux completely, and this has been shown to have excellent long-term results in patients who undergo this procedure, and more than 95% of these patients have long-term symptom relief. They are able to eat the food of their choice, they are able to stop their medications, and this is the best procedure which can control volume reflux and extraesophageal symptoms. So if you ask me what is the procedure of choice, whether it is endoscopy or surgery, I would say surgery is the best procedure for GERD, and it is laparoscopic Nissen fundoplication. Thank you so much.